So apologies for that. And thank you very much for being here. It's my pleasure to talk about this, to give some of the background of a project that began actually several years ago. It began by really looking at around 2016, the fact that in the Valley, there was a higher than national average poverty rate among children 0 to 5-year-olds. So based on that data, we began to look at some of the other data that was coming in from the Valley Community Index. Data Haven's analysis of the 2019 US Census included the 2019 index. And a deeper dive in that showed that the population had actually increased the poverty level since where it was in 2016. 4 of the census tracts in the Valley showed at least 68% of children 0 to 5 years old live at or below federal poverty guidelines. That was in Ansonia, 2 census tracts where it was 68 and 73%. Derby, where 1 census tract was actually 80% of children 0 to 5 live at or below federal poverty guidelines. And in Naugatuck, the number was 68%. Over 1,300 children ages 0 to 5 live in these areas. And you can see the breakdown here of where it is, and that there's 1,333. And with the newest census tract data coming in, we think that that is going to still increase even more. So as a group, we looked at what are the risks for children 0 to 5 living at or below the federal poverty level. And there are 2 basic categories. One is adverse childhood experiences. You can see what those are. And also the social determinants of health, which are caused by income and social status and employment, working conditions, education, physical environments, behaviors, access to service, and so forth. So when you think about the number of children living at or below federal poverty guidelines, it's not just the poverty, it's everything that's happening and the significant impact on people's health. So a little background, there was so we gathered people together, and there were about 27 nonprofit organizations, the mayors of the towns, and different individuals who came to the table and talked about a systems change approach to addressing this. A little bit of history of this is that the Valley has a tremendous history of working together to affect change. In 2017, it convened partners to address, the collective impact, but it goes even back further than that. And so when looking at childhood poverty, the decision was to explore the possibility of taking a systems change approach to that. And what that means is looking at some of the root causes that is causing the poverty and how do we go about addressing it. I will say the number of partners sought out the consulting group FSG, which has a long history since 2011, working with collective impact. Went for a couple of days of training in Boston, and also recognized that the Valley is a microcosm where you really can begin to implement and affect change in a real way by working at a microcosm level. There were between 25 to 30 entities from private, public, nonprofit sector who convened to do this. And since 2017 and 2019, the poverty rates were continuing to increase. So this became more than just, wouldn't this be a good thing to do, but really to the point where it speaks to a real problem and a pending crisis. So systems change basically has 4 tenets to making an approach. So it's both community and leaders contribute to a shared vision. It's not done by nonprofits alone. It's not done by, municipalities. It's done in concert with the community looking and addressing the problem. And we look for formal data and community voices that will drive decisions and drive outcomes. So for a system change process to work, you really need to go into the communities, find what the residents are thinking, feeling, and bring that data and community members back to the table to affect the change. It is a vision, and the plans also need to address the inequities that are in these communities compared to the rest of the census tract area. And the fourth tenet is that real change requires a long-term commitment. You're not going to identify the root causes of problems. You're not going to get a community engaged in solving these problems, and you're not going to be able to look and implement strategies in a year or two. It often takes anywhere from 5 to 10 years to begin to see the results of any kind of a systems change initiative. Right now we're about 3 years in. And what we have done is a lot of the data collection, and then a lot of the initiatives were identified, and strategies relative to those initiatives are what you're going to hear about tonight. But what I want to share with you is the impact of the data. So 71 people in those four census tracts were interviewed. And when you think of the 71 people in the context of families and people who are living in those communities, we ended up having about somewhere between 25 to 30% of the community was surveyed. And that's a really good number when you're looking for impact. So the general findings, this we found really interesting. 79% of the respondents said they had enough food or money to buy food. And I should also mention that as we were doing this survey got underway in June of 2020, which was at the beginning stages of the pandemic. 66% of households said that they received some type of services, such as food, housing, or fuel assistance. The majority said their health was either good or excellent. Only 2% said it was poor. At that time, the majority had not lost their job or had their hours cut during COVID-19. 17% have completed high school or GED. 45% have some college or an associate's degree, and 17% have at least partially completed postgraduate degree, and 10% have completed a bachelor's degree. So the numbers were kind of surprising when we actually looked at what those findings were. There were common aspirations that we asked everyone. So what almost everyone said is that they want their children to be healthy, happy, have a good education, and have good employment. It's what we all wish from this. They wished for support systems for parents and families in their own neighborhood. They didn't feel that there were adequate support systems, or they didn't know what those support systems were. They wanted greater engagement within their own community and within the faith community. They wanted better schools and education, stronger family support, and more time to spend with children. And they wanted to be able to improve their own well-being, mental health, physical health, and education. So those were the common aspirations that we heard and that were found in the written part of the survey questions that we asked them. And the survey we sent out was both, pick your answer, and we also allowed a lot of room for people to write what they were thinking and their own thoughts. And a lot of the more anecdotal things, like the wishes for what they wanted, came out of what they wrote. And there was such common themes when we read all of them. So then we went and conducted several focus groups, and the focus groups also validated the survey findings. And there's a lot of words on these pages, and I apologize for that, but I'll just summarize. When asked what would make life easier for you and your children, financial stability, parental support groups, childcare is a way that any of these things can happen in your community. Definitely parent support groups can, letting kids be kids, reaching out to neighbors, having some kind of a neighborhood network, checking on the elderly, offering to give someone a ride, having someone there for someone that feels isolated, creating such things as neighborhood gardens. There were also some discussion about, could we create a neighborhood app that would help us know who else is in the neighborhood, what supports are there, what resources are there that we could share with each other. Finally, participants were asked to explain how they would like to see the following work. Childcare. Know your neighbors well enough to help with childcare, have childcare resources in the community. Access to healthcare. If a neighbor needs a ride to a doctor, they could go to a neighborhood app. Access to healthy food. Transportation, another issue, and remote learning. Kids could help each other. So in everything we saw that childcare really rose to the top of the pile, and creating somewhere where there could be neighborhood supports and access to neighborhood supports and access to neighborhood resources. Areas of shared concern. Childcare. Many respondents do not have access to childcare. For those parents working from home, it meant interruptions and loss of productivity. In several cases, parent had to stop working or lose hours, not because of job loss, but to ensure adequate childcare. Others noted limited or minimal time spent with their children due to work schedules, multiple jobs, and or working away from home. Particularly the multiple jobs, overnight shifts, those times of the 3 to 11 or the 11 to 7 shifts not being covered. So having accessible, affordable childcare at the times and nearby when you needed it was really a huge concern. Another big concern was the lack of knowledge of community resources within their community. In spite of the strong presence of nonprofits in the area and other resources such as municipalities or 211, participants frequently noted how they didn't know where to go to find out what resources might be available. They didn't know what they didn't know. And a little bit of a surprise because, we kind of think we're out there with everything, but so many people just didn't. And it was interesting to me because I had done a couple of the focus groups and it was just these casual, how did you hear about that? Oh, I didn't know that was available. And so it was just being able to have that knowledge and the ability to create community supports within their own community. Some way to create or organize parent and neighborhood support groups so that neighbors could connect with each other. So the summary of the findings that we had was providing basic needs does not alleviate or diminish poverty or childhood poverty. In many instances, the people we interviewed had their basic needs met, but there was still childhood poverty. The nonprofit sector has done outstanding work in providing basic needs, but it is an isolated impact. Collective impact initiatives need to work concurrently on a larger systems level scale in order to move the needle from basic needs to something that can begin to address the poverty issue. Parents know and understand what they want for their children, but don't have the time, resources, and network to achieve it. What they want is beyond basic needs, a sense of community, time with their children, and assurances that their children are well cared for. Not having resources in their community provided by people who live in their community is a significant impediment to creating a more secure quality of life. Lack of affordable, accessible childcare provided by people in their own neighborhood is a barrier to reducing childhood poverty. Parents and community residents want resources within their community that they can create, that they can trust, and that they can sustain. And some of the individuals participating in this survey and attending focus groups sat in the Zoom rooms to help design such a network. So we go back to the collective impact framework, and the problem statement that we identified is there are over 1,000 children aged 0 to 5 who live at or below federal poverty guidelines within specific census tracts in Ansonia, Derby, and Naugatuck. The goal here is that within 10 years, this number will be significantly reduced. And the hypothesis is that the barriers to reducing poverty are the root causes which prevent parents and single moms from accessing opportunities, or single dads, such as jobs or education. Before job training or education can change someone's circumstances, they must be in a position to take advantage of such opportunities. And that's what we heard from the feedback and the surveys and the conversations that we had in the community. The root cause is that people with lived experience identified are based on capacity and infrastructure issues, not on any one isolated factor. Lack of affordable, accessible childcare within the community, provided in the community by residents in the community. Lack of a community support infrastructure that can provide assistance within and for the community. And lack of uniform, consistent awareness of all the resources available to make education, job training, or transportation, or any other issue possible. So I am now going to turn it over to Val to take it from here.
Thank you, Sharon. So you heard loudly and clearly that the number one issue was affordable, accessible childcare. And I'll take that a step further and say that it is also about quality childcare. What we heard from a lot of the families, and also as we started to do the research on this, is that there were places that people could bring their children, but they didn't feel comfortable for whatever reason. And they really wanted to make sure that they had a place that they could have their child go where it could be a trusted environment. The recommendations that we're going to talk about in just another minute are from 8 members of the task force that included both professionals and community residents. Next slide, please. The problem statement, as Sharon has been talking to you about, has been the primary area of concern is the affordable, accessible childcare. But the thing that I want to bring to your attention is that we heard over and over from families that not only was it this affordable, accessible, and quality childcare, but it was also for children, especially infants and toddlers, and especially for care during off-peak hours, which is, as Sharon said, that 3 to 11 or the overnight 11 to 7 shifts. And childcare is not readily available in all of the communities. It is available for a number of good childcare providers, and from a number of good childcare providers. But in general, there still is an awful lot of childcare slots that are lacking here in the Valley. We explored many options as we started doing the task force work. So there were 2 task force, one that focused specifically on childcare and one that focused specifically on community resources. We looked at traditional models, including alternatives that had previously been available, but had closed down, considering if we might be able to reinstate some of those options. Many of you may be familiar with some of the childcare options that have closed or have merged, and some of them that you probably didn't even know existed and are no longer a part of the childcare system here in the Valley. The number of childcare slots available and the waiting list to access those slots were also looked at. And we also began to look into alternatives that were being researched in cooperation with the Ansonia Superintendent of Schools, who has also recognized the severe shortage of this particular issue here in the Valley. There are less restrictive models that include the availability of things such as nanny services for short periods of time. So for instance, you wake up in the morning, your child is sick, has a fever. Could we tap into a nanny system that would allow a temporary person to access this kind of care? Worker owner models that might be established within the community are something that we thought was a possibility, a very strong possibility for us to be able to help not only to have the childcare that was needed, but also to look at how residents in the Valley might begin to find employment. Next slide, please. The worker owner model had probably the most potential of all of the ones that we looked at because it could be located within the community. It could be more affordable because there is no specific management hierarchy in this model. If an affordable site within the community could be located, it could help to reduce the cost. And we looked at several across the country, and the ones we found were ones that were either getting some kind of break on their rent, and so that helped to reduce the overall cost. The model would provide not only childcare, but a means to generate wealth in the community. And it could be sustainable by transitioning the business to other community residents to create the more generational wealth that has been a challenge here in the Valley for a number of years. Next slide, please. So again, there are a lot of words on this page, and I promise that we will have this slide deck available to everyone who is participating. And as I said, this is being recorded, so we'll be able to have it up on our website and also on social media so that people can view it at a later time. But I'm going to hit the highlights of the recommendations here. Create a worker-owner incubator model that will provide new childcare entrepreneurs within the community a supportive place to learn business skills necessary to launch and sustain a profitable business. Engage a consultant knowledgeable in childcare licensing to help develop the plan and recommend training that includes the necessary credentials for childcare and the business skills to operate the business. Utilize the training models developed and utilized by a group called Seed Comment. It's a cooperative which has done extensive work in this area and is offered at no charge. And obviously we will continue to look at whatever grant options are available that would be able to help us get this off the ground as well. The plan should also include establishing a franchise model where there could be necessary required consultants, education, health, etc., those that are required by law, engaged to oversee all of the businesses, to be able to provide support, to be able to provide professional development. As you note, this role can be filled by a nonprofit providing childcare services, or perhaps another childcare agency in the Valley might be interested in doing this. As I mentioned before, businesses should be operated out of a shared space and building to better facilitate the work of the consultants and to reduce the expenses. What we learned is that if there is a suitable site where 4 to 6 family daycare businesses can be located or co-located under perhaps one franchise, maybe overseen by an education facility or any other necessary consultants, an existing childcare organization may also serve this role. The plan should also include a startup budget and operating costs for the first 3 years to ensure that it is a viable, sustainable model as it looks for the necessary financing, both from the outside and whatever, as I said, grant opportunities that might be available. And last but not least, an RFP should be extended to engage a qualified consultant to be able to assist in this work. Next slide, please. So right now I'd like to ask David Morgan and Monica Oris, the other tri-chairs of this committee, to come off of their muting and their video. David, I'd like to turn to you first. If you could share a little bit about the importance of early childcare here in the Valley and all the work the team has been doing and how that might be able to connect through this particular project.
Yeah, sure. And again, everyone, we thank you for your grace and your tolerance and patience as we're, doing this virtual experience too often, but really appreciate your attention to this. I think what makes this, a lot of that poverty data that Sharon and Val were presenting tonight, what makes it even more tragic is what we clearly know through the research and the science around early childhood development. We know that children are born wired for feelings and ready to learn, that there is rapid brain development, more so in those age 0 to 3 years compared to the remainder of the entire human experience. And we also know that the brain is at 90% of its development by the age of 5. And the point is, early experiences matter. And these income-based disparities negatively impacting young children, as well as student outcomes and trajectory going into kindergarten and through the school experience, has a devastating impact on educational achievement, health and wellness, quality of life, recreational life skill opportunities. And so there really needs to be a sense of urgency, a sense of us, and a sense of now as we think about creating generational wealth and trying to reduce, mitigate, and ultimately eliminate the impacts and the existence of low-income poverty conditions. When the last thing I'll say is when we're talking about childcare and what we're hearing from our survey responses is children are not, their outcomes are not isolated in and of by themselves. Their outcomes are influenced by the adults and the caregivers surrounding them within the family, within the home, as well as within their life experiences. So anytime we talk to these recommendations that Val is laying out, we have to equally think about what we call that 2-generational approach, that it is not just the child's experiences, but also the adults in that ecosystem that is surrounding that child. And when we speak to generational wealth creation, some of those entrepreneurial ideas, it's actually kind of a 2-part effort, not only increasing accessibility to quality childcare experiences, but also creating opportunity for individuals to provide childcare. And we hear a lot about childcare. We hear a lot about universal preschool and the amazing work of our school districts. What we don't hear a lot about is family childcare. And you may not know, it is actually one of the largest settings for young children. And so how we can bring that, to Val's point, within our poverty zones, within our communities, can have a 2-part effort, not only providing access to childcare, but also increasing opportunity for generational wealth. I'll pass it over to Monica.
Hi, everyone. Certainly thank you guys for inviting me to participate in this certainly important work. I will say that I support the work being done with the collective impact project. I think it's been, there's been a lot of great work being done behind the scenes, and really thank you to Sharon and to Val for sharing it, because I think when you see it all on paper, it really does show the great work that's been done, and some of the interesting discussions that happened with our panel of participants. I do support the collective impact. I think it's really important. Childcare certainly is helpful to have folks be successful in their work and in their career. As a nurse, when I worked evenings and nights, I had the benefit of having a spouse at home that was able to care for my 3 kids when they were young and they were infants. And one of the things that we found through our participant surveys and interviews is that not everyone has that. A lot of single parents out there, maybe family not nearby, and childcare is certainly a challenge. That came up with at least a handful of the interviews that I was lucky enough to participate in. So hearing those parents explain the importance of childcare and their challenges not having quality, reliable, trusted childcare was really came up as a serious challenge for a few of the single parents that I was able to speak to. And even during our COVID crisis, Griffin saw firsthand what not having childcare did. Our staff was unable to come in and do the work we did caring for folks that had COVID-19 during our peak waves. And thankfully, we were able to rely on team, and they were able to take many of our staff members' children so that our staff members could come in to work in the hospital and take care of patients who are suffering. So I think having childcare, certainly first and foremost, is an important area to focus on. I do think it will give folks the ability and the confidence to pick up their careers and have an opportunity to develop maybe better work opportunities. And I think that's really a focus of this. So I look forward to hearing more about this and seeing how we could partner on these things.
Thank you, Monica. And I think that Monica brought up an excellent point that, you know, even in the midst of COVID, the Valley was coming together. Look at Team and Griffin of working together to provide the necessary childcare and to become an essential part of all of that work. When things were closing down, they both had stepped up and had their all of their workers literally just putting their lives on the line in order to make sure that all of us were safe here in the Valley. And, you know, as we continue to come out of the COVID-19 pandemic, one of the things that has become clear is that the need for quality childcare is not going away. Thank you. Next slide, please. So in next steps of this work, we are going to be continuing to be able to get community residents, to get the feedback of community residents. We're going to make sure that this information gets out to those folks living in those 4 census tract areas. That's part of the reason why it's being recorded, so that we can take it out, we can have it up on our websites, we can bring it to PTO meetings, we can be able to make further presentations so that the residents in those census tract areas who may be interested in pursuing this worker owner model for childcare will hear about it and will hopefully be able to continue to come to the table and work with us. We'll also begin to identify additional potential funding sources, which could help provide the startup cost for this project. Look at a site for housing the initial worker owner childcare. Coordinate with local state representatives to see if the Valley can be added to the state child incubator pilot project that is going on all throughout Connecticut. And extend an RFP to qualified consultants to take on the planning and initial execution of this initiative. Next slide, please. So the other task force that was worked on over the summer was the Community Resources Task Force. There was a working group of about 20 people, including parent navigators, coming together to examine what resources existed out in the community, where there were gaps, and what we could do to bring that information back out into the Valley, into Valley residents. Next slide. The biggest problem was a lack of knowledge of what community supports or resources are available. Knowledge and access to the resources are not easily accessible in those 4 census tract areas that Sharon described earlier. Existing resources that are available, parent liaisons, 211, even nonprofit resources, aren't known and accessible to everyone. It gets back to Sharon's point during her focus group that people were saying during the focus group, oh, I didn't know that existed. Oh, what is 211? And, you know, we all in this sector, in the nonprofit sector, in the philanthropic sector, we work with this information on a daily basis. But for families out living this in an everyday life, it is very challenging for many of them to be able not only to know that they're there, but as you see at the last point, that there wasn't a comprehensive list of existing resources available. We were able to put together a wonderful community resource guide. The committee members identified the resources. The task force folks worked diligently for several months, putting all of the information together. It was what do we know? What are our treasures out in the valley? What are things that are shining examples of the the resources that are available? And again, identify the gaps. Griffin and through Monica provided a prior list that was gathered that was including comprehensive community resources. And then Sharon Danosky and her team compiled all of the resources, those from the committee members that had done a tremendous job to put everything together, the resources from Griffin Hospital, updated all of that information from the organization websites, put it all into one guide. If a resource was not available through the website, it was included. Resources have been categorized by town and by service type. Service providers who provided more than one service are represented multiple times. But the most important point of this whole slide is that the resource is only current as the day it was accumulated. Already, our guess is that those over 400 identified resources in the guide, several of them are probably not even current any longer. Next slide, please. So there were a lot of recommendations for how to get this resource and the resource supports out into the community. One of the things that bubbled up to the surface almost immediately was to designate a primary person or a group of people who are going to be responsible for continuing to update this information and to get it out to the community in a variety of different ways. You notice the next part says the individual must be paid and not be a volunteer to ensure consistency. We've all lived through people that have great intentions and that have volunteered their time and then have circumstances in their life change. So it's really important that these people are, these people are paid and live in at least one of those 4 census tract areas, if not all of them, and be available to the residents in those 4 census tract areas. As members of the community, the individuals will have knowledge of each of those census tract areas and can then become trusted resources. As I said before, this person or these people will be responsible for continually to update and add to the resource guide. The resource person and people will also be the go-to people to establish neighborhood support groups. They will be the ones that people will feel comfortable with, that they can trust. They're a face in the community that says, yes, I live here. I truly value and understand what is going on, and you can trust me because I don't live too far away from you. I live 3 doors down, or I am on the next street, or wherever the case may be. It is important to recognize that each town in the free Ansonia, Derby, and Naugatuck, but quite frankly, we know this about all of the Valley towns. Each town is different, and when and where and how this person should be located on a rotating basis is going to vary from town to town. We came very, very quickly to the conclusion that we couldn't just have one person be responsible for all of the Valley communities, that it would really need to be divided up. Perhaps it could be one person and then several people working with that one person. The person could be located in a town hall or a library or a nonprofit within the community. And it was really important that it should be hyperlocal and serve as a community hub. It is critical that the position and the location for the community resources are not dependent on any single source of funding or place, so that they will be sustainable and not succumb to budget cuts. We've all, again, lived through that. These are important positions. This information is important. And yet, when budget time comes, they're one of the first things to go in terms of cutting costs and being able to not have this information, unfortunately, get back out into the community. The last one is an interesting one. Create a governing body of nonprofits in the community, perhaps with a backbone organization to manage the resources and person or people. So in the next slide, I'm going to turn back over to David and Monica. And Monica, I'm going to have you go first this time to talk about the work that I know that Griffin has been doing with this statewide database, and then the whole concept of having this community champion or champion models.
Okay, thank you. Thanks, Val. Yeah, so I think most folks probably have heard me get on the soapbox, either at the Valley Council meetings. We had quite a few meetings here at Griffin a few years ago now for Unite Us. And Unite Us is that statewide database that the Connecticut Hospital Association has supported to roll out around the state and to use as a main source for healthcare organizations and community-based organizations, not-for-profits, as a way to get referrals to them. And Unite Us has done a lot of great things. Right now, I think it's also at New Vance, so it's in 3 hospitals: New Vance Health, Danbury, New Milford, and I believe Norwalk Hospital are using Unite Us, as is Griffin, and so is Yale. And I think the hope is to expand our reach and to get more and more folks on using Unite Us. The benefit of using Unite Us is a closed loop social referral platform, and it's working out amazingly well. In fact, some of our CBOs who were a little bit reluctant to use Unite Us, after a little bit of convincing, started using it, and they said, geez, it's so much easier. We don't want to be called anymore. We want you to make the referral through Unite Us, because now they're using the website and they're able to go in, see the referral, respond to it, help that member out. And then we, as the referring source, could see what happened with that client, which is really a win-win for all of us. I do feel that it's a great opportunity for us to use the statewide database as a community resource as well. And not only are we hoping to get our community-based organizations more robust, so anyone that's not using Unite Us would certainly love to get them to use it. It's free for community-based organizations, but I also feel it would be really useful to have some of the community-based organizations and not-for-profits who are receiving these referrals through Unite Us to go a step further and become a referring agency as well. So I'll use an example. If a member comes in for food and one of our wonderful food pantries in the Valley finds out that member says that they're having an issue with domestic violence, then that food pantry could in turn help that member and refer back to maybe a BH Care or to another domestic violence resource in their area. And I see that really expanding the network and becoming a really strong way for us to make referrals across our immediate community, but even further. I know Griffin, we get folks that come from all over. We've made quite a few referrals to patients who have come through our door or clients who have been referred to our community health worker. And those members are going to community-based organizations in New Haven. So it's great that we could use that database for that reason. The other thing that Unite Us is definitely improving its own processes. Initially, we were able to get data that was based from an entire state, so statewide referrals. Well, now they've made some great enhancements to the reporting capabilities. So we're now able to see specific patients, not any identifying information, but specific data on patients that Griffin is making referrals to. So we could see how many referrals came from Griffin and went to Team, how many referrals went to the Seymour Oxford Food Pantry. And those are things that could be really useful, especially as we consider rolling out this model. And just to speak on the community champion model, I'm certainly a firm believer in that. During the COVID vaccination project that I was part of, and since the beginning back in January, we had an organization that really did a town that did really well. And it did so well because it had that role. It had a community champion. We were getting folks that were really hesitant to get the vaccine. And this community champion would go knocking on doors, telling them where the clinics were going, when they were going to be there, why they should get it. And this town had probably one of the highest vaccine rates in an area that, according to all other statistics, would have a very low vaccination rate. And I do feel that it's because that community champion model was so strong in this town and in the neighborhoods that they really pulled together all the different groups that were part of this town. And the town was big. It was Waterbury, and It was a really successful town. We had multiple clinics, and this person would go around telling everyone they knew where these clinics were. So I definitely am a firm believer in having a strong community champion and having that one resource to tell people where they could go and how they could get the resources they need. Thanks, Val.
Thank you, Monica. David, share a little bit about, I'm going to ask you to take off your team hat for just a second and put your Valley Council hat on and share a little bit about what potential role there might be for the Valley Council with all of this.
Yeah, sure. I mean, it is no secret that the Valley Council for Health and Human Services is an exemplar that many other areas of the state of Connecticut, and I'd even argue beyond the state of Connecticut, could take a page from. Silos are the undoing of families. The stronger we know one another, the stronger we mutually align our efforts and activities, the better the outcomes we will see. And we have a framework within the Valley Council for Health and Human Services, close to 40 nonprofit organizations. And to Monica's point, when you think about the work that Griffin Health has been doing and many community-based organizations throughout the Valley Council, it's recognizing, the desperate reality that of what we're navigating right now. We can look at a zip code. You saw some poverty zones that Sharon illustrated earlier, and this desperate reality that you can look at, one zip code, one social, economic, or environmental background, and the unfortunate reality of foreseeing an increased likelihood of poorer health outcomes, limited to no access to quality health care, chronic health conditions. And when you look through the lens of the Valley Council for Health and Human Services, we are very staunchly believe that demographic is not destiny. We know and believe and recognize that people do not wake up and say, I want to be poor today. As a Valley Council, we also believe that our job is bigger than making poverty livable, as I often say. We want to be able to get in a time machine and look at, 10 years from now, when we truly embrace a collective impact model, that we're truly looking at root causes, and we're mobilizing resources, and again, mutually aligning the work. And, as strong as the Valley Council for Health and Human Services philosophy and framework is, it needs dedicated staff. It needs dedicated resources. The work that it does is so above and beyond its small but mighty capacity. And so we don't need to look very far when we think about an anchor, a backbone organization. It truly can lie within a Valley Council for Health and Human Services. We need to roll up our sleeves a little bit and think about the mechanics of who and what is that dedicated staff, what types of champions. We can think of other, we have the Greater Valley Chamber of Commerce, and we know, when Mr. Purcell is sitting there, that gentleman is representing the chamber. The Valley Council for Health and Human Services does not have that. It has an exceptional brain trust of champions from 38 to 42 nonprofit organizations. And then, of course, some of the dedicated resources, so we can truly move that needle. When we begin with the end in mind, what do we see 10 years from now around creating economic opportunity, creating generational wealth? The Valley Council for Health and Human Services is most certainly the most likely, with the most vast potential to really embrace the collective impact model.
Thank you, David. And I just wanted to make a note that we have been truly honored to have two of our co-chairs for the Community Resources Initiative from Naugatuck. There is a similar group in Naugatuck to the Valley Council that I know is absolutely willing and ready to see how they could share and collaborate as well. So, and David, you're smiling and you're nodding because you have worked with that group as well. So we are looking all across the Valley as we can to be able to bring as many of these resources together and to get them out into the community. Thank you. Next slide, please. So as we come to the near close of our presentation today, Some of the steps that we're talking about needing for the Community Resources Group is to designate a backbone organization that can support this effort, to secure funding, to be able to have this as a long-term entity, recruit and empower a governing body, develop a budget, all of those things that one would expect, develop job description and expectations for a community resource person or persons, people, recruit for that position or positions, and establish the locations that will be out in the community. So in summary, this work has taken over 2 years with major emphasis on gathering community data, having community voice, even during COVID-19. This is not about everyone sitting together and saying, hey, we've got a great idea for you and this is what you're going to do. It is really about having the community voice help to drive how this work is going to happen. We listened to the community through our survey and focus group process, and they told us what would make a difference, all of the points that we've talked about earlier in the presentation. The recommendations have been carefully considered and include that community input and will continue to include community input. The next steps are to continue to recruit the community members, as I said before, to act upon the recommendations. We are truly grateful for the Valley Community Foundation and the Community Foundation for Greater New Haven stepping forward initiatives for not only their financial, but their technical assistance support. We have been truly honored to work with both of those foundations to help to continue to get resources to help support this work where it is needed the most. We also wish to say a very special thank you to our task force co-chairs, Jill Mahoney and Kelly Tremlett from the borough of Naugatuck, Kathy Kellett, who was the co-chair with Love Hunter of the Child Care Task Force, and every member of both task forces for the incredible work on this project that they spent doing throughout the summer. The hours of countless volunteer time, gifts of time and self that all of these people put together are amazing. We were able to accomplish so much in a very short period of time. Together with all of our community partners, we are committed to taking the next steps towards reducing childhood poverty in the Valley. Last slide, please. This is a quote that talks about systems change. Funding an ecosystem approach instead of jumping from issue to issue guarantees maximum reach without silos, as David was talking about earlier, trying to claim credit that their issue was the one that carried us all over the finish line. We often talk about the spirit of collaboration and cooperation here in the Valley. This initiative is a shining example of what can happen when we all work together to achieve a common goal. For those of us who like to see something go from point A to point B to point C to point D, this has been incredibly challenging work. This has gone from A to F, back to C again, maybe a bit of B, and back over to G. It's been all over the place. But I can honestly tell you that this collaboration is so very important and truly is a shining example of what can happen when everyone works together here in the Valley. We look forward to continue to keep you abreast of all of this work and to the next steps that we will be taking with this initiative. Thank you so very much for taking time out, and we look forward to working with you again in the near future. Have a great evening.